Alright, so what I'm going to be doing today is an extubation on a patient, and I'm going to explain like the following procedures on what should be done. First off, we're just going to verify the order and go check all orders, make sure that they're on date. So we're going to verify the order, and we're going to make sure that we're going to extubate. Alright, we're going to maintain the sepsis by gloving up, already sanitized, and we just don't want to get anything nasty on our hands. Alright. Hello, Mr. 1234. I'm Victor with Respiratory, and I'm here to perform an extubation on you. Can I just verify some information on your bracelet, please? And it says here your last name is 1234. And can you give me your last name? What I want me to do, since your internal problem was reversed, there's no more need for you to be on a ventilator. And I've already conducted a spontaneous breathing trial, and you have passed the test. So we're just going to be taking the tube out of you, alright? And what I'm just going to do is I'm going to suction you a little bit, hyperoxygenate you, and we're just going to withdraw the tube. While I'm withdrawing, if you just could give me a few coughs, and I'll like indicate more stuff you have to do while we're doing it. Alright, so what we're going to want to gather is our cool mist, have it ready to go, have an bamboo bag just in case. We're also going to want to have our suction ready, pressure of -100 to -120, and we're going to have our syringe ready to go as well as our towel, just to place the tube in and get all that nasty stuff out. Alright, we're also going to need some racemic epinephrine just in case of stridor while extubating, alright? And we're just going to have this on hand. Doesn't mean we're going to administer it. Alright, we're going to test our suction real quick, make sure it's working. And it turns on, and then I'm just going to improve the tubing a little bit, and it's going to show that I have at least -100 to around -120. Alright, since the patient is still connected to the ventilator, we're just going to hyperoxygenate him, and on our ventilator we're just going to set FiO2 to 100%, make sure his saturation is at 99% or 100%. Alright, so what we're going to do is suction you right above the cuff and right below, alright? Remember, we're only going to suction on the way out when it's above the cuff. And it's going to go in. And we're going to suction you one time right now, alright? And suctioning. Alright, looks like we got some secretions. Alright, and we're going to suction you one more time above the cuff, and only suctioning on the way out. There we go. Alright, Mr. 1234 is in Feller's position where he's going to get ready to extubate. And he's hyperoxygenated, his saturation levels at are 100%. We're just going to remove the tube holder real quick. And here we go. Going back on the vent real quick. Alright, and then we're just going to suction. We're going to do this all thoroughly. I got my aerosol mist ready just in case, right after. Well, we're going to use it. Alright, and Mr. 1234, I want you to inhale, and then I want you to give me a good strong cough so I can pull this tube out, alright? We're going to deflate the cuff, and we're going to have and suction on the way out, alright? And taking the tube out, there we go. Going to get the aerosol on. Just to reduce any swelling in the airway, and we're going to have him at an FiO2 of 40 since that's what we had him on the ventilator. A good FiO2. We're going to listen to the neck for stridor, and we're going to listen to lung sounds. Clear breath sounds. Going to auscultate the bases. Clear. 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 Alright, Mr. 1234, if you could give me a few coughs, that would be great, alright? As strong as possible. We're just going to go ahead and clean up everything, monitor our patient, and write down what time we extubated, his vitals right now, and continue assessing him for the next few hours. Alright, now we're just gonna chart off all of the information that we got from our extubation procedure.